Well, good afternoon, everybody. There's been larger panels. We were going to have a very intimate panel of 3 people, me as a moderator and 2 guests, and we're down 1. So now we're even more intimate. Unfortunately, Dr. Hood doesn't look like he's available, but I'm very pleased to be joined by Pam Toto, who's director of the Healthy Home Laboratory here at Pitt. And we're going to be talking a little bit about aging. Part of aging is resilience. So I was just going to ask the questions, but now I think because we're missing a panelist, I'm going to answer some of the questions I'm posing as well. So we'll see how that goes. But it's a pleasure to be here. Pam, maybe you can just tell a little bit about the work you do here at Pitt, and how you manage to bring technology into sort of real-world applications in the aging space.
Hi, everyone. I'm Pam Toto. I'm a professor here at the University of Pittsburgh in the Department of Occupational Therapy, and I am the director of a place called the Healthy Home Laboratory. And if you haven't been there yet, you should come see it. The Healthy Home Lab is a concept and a place. It's made up of interprofessional team members from the university: engineering, nursing, social work, public health, occupational therapy, emergency medicine. And we are implementing solutions, technology solutions, including using AI, to help people successfully stay in their homes and participate in their lives, otherwise known as aging in place. So we create new technology, we evaluate technology, we improve technology, and most important and dear to my heart as a clinician at START is we deploy technology. So earlier at lunch today, we were hearing about helping Pittsburgh and helping the world who's aging to be able to age in place. And I know and I believe that we have the solutions now for people to be able to live well wherever they want to live.
That's wonderful. Again, I was not going to answer any of these questions myself, but I will now because of the...
Thanks.
So I can just say that I direct the Aging Institute here at Pitt, and my colleagues and I are very interested in a little bit more basic than what Pam is talking about. We're interested in the sort of basic biology of aging. And so we have about 13 faculty members that really try to understand what are the molecular drivers of why and how we age, and then to use those insights into sort of the mechanisms of aging to identify potential targets that we could intervene on, and most likely with small molecules and drugs, basically, sort of as a way of potentially, not necessarily making people live longer, but improving sort of the health span of individuals and preventing age-related diseases. And finally, we are also doing small clinical trials in this space, what we call the geroscience space, which is, again, trying to use those drivers of aging to identify targets to leverage. And so we have an ongoing trial now that's looking at inflammation in aging. So one of the important, we think, mechanisms that predisposes to chronic diseases and poor health span is an activation of the innate immune response in individuals. And so we're randomizing people over the age of 70 with evidence of high levels of inflammation to either an antibody against IL-6 or a placebo, and asking if we bring down that level of inflammation, do the people feel better, think better, move better, et cetera? And can we sort of, again, improve the quality of life, again, using these insights from basic science? So we're on sort of different ends of the spectrum, and from practical to sort of basic, but hopefully we can cover a lot of the questions. So I guess my first question would be, how do you think artificial intelligence is changing how we understand aging and disease, and what do you think are the breakthroughs sort of on the horizon?
Sure. So I think that, I'm not the one to say this, but aging is a new phenomenon. We used to not age as long as we didn't live as long as we live now, and because of healthcare and because of innovation, we live longer, but we're not so good at helping people live well. And what we know is that as we get older, we actually become more heterogeneous, or aging is complex, and aging well is even more complex. And so we try to stamp and rubber stamp a lot of people into different packages, and it's really hard. And so for me, I think that AI hasn't hit as much as it could my end of aging, and I'm excited about the possibilities, because I think that we keep trying to simplify the solution, and maybe the solution is chaos, right? And so AI would allow us to take all this research that's been conducted in the different trials in different areas and be able to digest that information to have more of a personalized approach for a client, not just based on what their medical diagnoses are, but where they live and what their motivation is and what's meaningful to them. So I believe that the future's still there, and I'm really excited about it, that it's a way for us to get better at taking the solutions that we know exist and helping people to age independently and safely.
Yeah. I think from, in my world, I think the contributions really will come from this idea of, I think the beauty of AI really is to distill, we're filled with information in the aging space, but to distill that information into sort of knowledge, basically. And I think for us, the knowledge that we really want to understand is we know how old someone is. We can just look at their driver's license. But that's sort of chronological age. To us, what's really important is biological age. That is how old your cells and tissues and organs really are functioning. And to get at that biological age is very complex. And there are obviously people who age faster and other people who age slower than the sort of chronological age would suggest. And even within individuals, I would argue that your different tissues and organs can age at different rates. And we had very good evidence of this. Actually, in my own lab, we made a mouse that we made a genetic perturbation that's not terribly important what it is, but that extended the lifespan of the mouse by tweaking one gene. The mouse lived 20% longer, which again, if it translated to us, tweaking this one gene would change the average lifespan from 75 years to 90 years of a human. But when we looked at that mouse, even though it lived longer, and individual organs, most of them had slower aging, but there were some organs that didn't seem to respond to that genetic change, and some organs that, even though the mouse lived longer, actually had faster aging. So even within a mouse, and I would assume a human, I think aging is a very disparate event, and so you can have tissues aging within the same person at different rates. And so I think for us, that complexity really would be hopefully useful. AI could be very useful in sort of getting that personalized signature for an individual in terms of how their cells and tissues and organs are aging, and presumably therefore predisposed for diseases of aging. And then, potentially leveraging that information, again, for a personalized treatment of that individual. So that, to us, is very exciting. Not to mention, I think, the advantages that come with drug discovery. A lot of the targets that we're trying to go after in aging are very difficult to drug. I wouldn't say nothing is undruggable, but they're difficult to drug. And that's because, again, many of the diseases that we have good drugs for, like cancer and inflammation, really are because of things that are, in a way, hyperactivated, pathways that are exuberant, and medicines can be used to slow those down or dampen them. But in aging, it's really not hyperexuberance, but the lack of the sort of normal pathways and processes that occur when you're young. And so getting medicines to rejuvenate things, it's a much harder task. And I think AI could be very useful in providing those classes of medicines that have been very difficult. So I think a lot in the space for us, and it sounds like for you as well. You've been very successful in bridging technology and science and innovation. How do you bring those forces all together, basically?
Sure. So I've heard a lot of panels today, and the truth is that for us to really be successful at the consumer level, we really need to understand what the consumer wants to do, needs to do, and expected to do, and is willing to accept. We have a lot of great technology that's out there right now, but a lot of older adults say, I don't want that in my house. I don't want Alexa spying on me. You may say that yourself, sitting in the audience. So I think that it's really critical that we have people who are building the technology with the clinicians who work every day with consumers, but also the consumer's voice. So at the Healthy Home Laboratory, everything that we do is driven starting with the consumer. So I neglected to say in my first little intro is that we have a house here on campus that the University of Pittsburgh has purchased. It's over 107 years old. Come see us. It's on Oakland Avenue, right down the way.
The house is older than the people in it.
Yes. And we furnished it to look like a real home. We have people come in and tell us what are the things that they like about their home, what are the things that are difficult, and then we, from there, look for solutions that make sense. What would you accept? What would you not accept? We try to look for solutions that meet people where they are. So if you think about this, being able to age well could be by improving the person, which is what we do in medicine oftentimes, or improve the capacity of the person. But we can also make aging well better by changing the way people do their activities and by making their environment more friendly. So we try to focus on those latter two, partnering with other departments, whether it's the Aging Institute or nursing or medicine. Yes, we can try to fix a person, but if we can't, if they have an arthritic knee that, you know, it's contraindicated for them to have a surgery, they should be able to live a good life too. And so how can we take the technologies that are available and make an environment more friendly that knee doesn't matter as much? And so I think just really bringing all the people together from the beginning and being able to come up with solutions that make sense based on ones that are usable. In preparing for this talk, I was thinking about low-tech technologies that have failed. And there used to be a thing called a hip protector, and someone built it, and they said if you put the padding on your hips and you fall, you might be less likely to break your hip. Well, it was a failure, partly because nobody, especially women, we don't really want to wear more padding on our hips than we already have. So it was ugly, it was unsightly, and it was a good idea, but didn't work. And I think that, you know, had they talked to the consumer at the get-go, maybe a different product design would have happened.
Yeah. How about like wearable technology? How is that impacting what you do and the sort of continuous monitoring of patients?
So good. It's a good question. So there's really a big market. Well, first of all, aging is a big market because we have so many people aging. So we could be benevolent and say we're all aging, so we're investing in our own future. But it's also financially wise for a lot of reasons to really help older adults live well, right? But some of the technology that's being developed is driven more by care partners sometimes, or by healthcare decisions, not as much older adults. So there's this tension between independence and safety. And so a lot of times older consumers want to be independent, and they might even risk a little bit of safety, but their kids want them to be safe. Right. And so we have all these monitors that are coming out on the market, but if the older adult doesn't want to wear it or doesn't want to use it, or they, you know, put a piece of black tape over the camera that their daughter installed in the dining room, then it's still not going to work. So I think we really have to understand the goals, motivations. We have to educate people as they're aging. And I also think, if I'm going to be honest, we're still an ageist society. So once someone has a fall or has an injury or an illness, everybody's looking at that person to saying, how much longer can they stay in their home? So I think if we were more confident as individuals, knowing that we're all working to keep people independent and well, maybe people would be more likely not to put the tape over the camera. Yeah,
I'm thinking about my own parents, and I remember when my parents had to give up their driver's license, how eventful that was in their lives, and that was pre-Uber or Lyft, and that would have changed. That technology would have changed maybe that decision. It made it maybe a little bit more palatable. So I think hopefully there are things coming down the road that will make those, you know, I think one of the things that I think people struggle with is the idea of independence, right? And as you said, I know a lot of, in my own experience, people are willing to sacrifice. I don't care about falling. I don't want to live like X or Y, basically. So
I think it's tricky. I also think that I know that there are a lot of factors we should consider, which is why AI would be such a nice tool. So I was listening this morning when, I think it was Brian Zaleski was talking about, driverless cars, right? And Pittsburgh is a great place. And if you live in the city of Pittsburgh and you can't drive anymore, you're not in terrible shape. We still actually have good transportation services for older adults. But in every county around Allegheny County and Pittsburgh, the #1 reason why people can't age in place is because of transportation. So you think about the intersection between health and AI,
Yeah.
driverless solution, car might be the
Liberating.
solution that someone in another county can still continue to age in place, but it may not be as big of a deal in the city of Pittsburgh.
How do you in your work bring together those teams of individuals to come up with solutions? How does that work?
So I'm an innovator, and I'm an implementer, and I believe in sort of a diffusion model. So in all of our practices, there's people who are, and this is probably an innovative group, but we're probably more innovative, and then there's people who don't like change. And so at least in our lab, there's enough people who are innovators that we welcome those opportunities to connect and interact, but we don't beg people if they're not ready. And I would also apply that to older adults. So technology, AI, and solutions are not for every older adult. We do know that older adults like the stuff, their self-efficacy is lower. So, if my mom screws up on an app, she's like, I'm too old to use the app. If my daughter screws up on the app, she's like, who made this dumb app? So we need to, I think we also need to meet people where they are and not offer solutions that someone's not ready to have.
Yeah.
And that goes true with our collaborators and partners. If someone were pulling teeth to get them to consider a new way of doing things, they're probably not the partner for us at this point.
I should say for us, it's also getting everybody to speak the same language, because when you brought up the falls, I remember we work on mice a lot, and we wondered, it's very hard to get a model of falls in a four-legged animal, right? Mice just, even when they get really old, they never fall. And so I think, coming up with models that work across, the spectrum of preclinical and animal models and humans is, that it really takes a conversation to try to figure out, okay, if we can't model falls, what can we use this model for to help people? Let me just close in a second. So Dario Amodei, who's the CEO of Anthropic, which is a $180 billion AI company, said that AI is going to double lifespan in the near future. So do you buy that? Do you want that? Do you think that's a good idea, a bad idea, a possible idea, or?
That's an interesting question. So I've had the privilege to have a long clinical career before I transitioned into academia and research, and I've had the opportunity to work with multiple people who are over 100 years old. I think the bottom line is people do want to live long if they can live well. But there's some other pieces in that. It's not just medical. It's not just being alive. Sometimes when the rest of the world passes you by and you're left, that's not such a good feeling also. I think giving people the choice and giving people more solutions to live well, is it the biology that makes you live longer, or is it the rich environment that makes you live well? So is it the environment that drives age, or is it the biology? We don't really know that answer yet. I know you're going to solve it, but
well, I don't know. I want to live long enough to see the Pirates win a World Series again. So that ensures a long life. So thank you very much, Pam. Thank you all for.